Next and final talk is laparoscopic cholecystectomy poses physical injury risk to surgeons. Analysis of hand technique and standing position. This will be presented by Dr. Yassar Youssef from University of Maryland Medical Center in Baltimore.
Dr. Arikai, Dr. Fink, ladies and gentlemen, I would like to thank the sages for allowing us to present our study about laparoscopic cholecystectomy poses physical injury risk to surgeon, analysis of hand technique and standing position. Can I move the next slide or how? Thanks. Yeah. There has been concern about laparoscopic surgery and the effects on the physical ergonomics. There has been surfacing data suggesting that surgeons who perform laparoscopic surgery are at increased risk of physical injury. We decided to study the effect of laparoscopic cholecystectomy on the surgeon's ergonomics. In the US, most of the surgeon usually stands on the left side of the patient, with the patient in the supine position, while in Europe, the surgeon usually stands between the patient's leg, who is placed in the lithotomy position. Another variation is the use of the hand technique. The two-handed technique is when the surgeon dissects with one hand, usually the dominant one, and retract with the other, while the assistant holds the camera. While the one-handed technique is when the surgeon dissects with one hand and holds the camera for himself while the traction is done by the assistant. This picture shows the between standing position using the two-handed technique. This one shows the between standing position using the one-handed technique. Using a virtual reality surgical simulator, 8 subjects each performed 4 procedures, 2 in different hands and 2 in different standing position, leading to 32 total simulated procedures. We used the Rapid Upper Limb Assessment Tool, RULA tool, which is widely used in physical ergonomics. The NASA TLX, a proven subjective tool for mental workload, was used. A report that is generated by the VR simulator was used to assess performance and surgical complication. A survey was given at the end for each subject. RULA will give you a score between 1 and 7, a low score indicating its ergonomic safety, and a high score indicating its risk for physical injury and the need for an alternative. I don't have a pointer, but it's okay. I can use the mouse, I guess. No. So this slide shows the end results of the RULA. And you can see that the between standing position, which is in red, had a high score indicating its ergonomic risk, while the between standing position in light blue had a lower score indicating its more safer ergonomic. The use of one-handed or two-handed technique did not alter the results. When analyzing the RULA scores for body part, it was clear that the worst ergonomic effect of the side standing is mainly related to its worst effect or its harm on the upper arms and on the trunk. The NASA TLX showed that the side standing position was significantly associated with a need for a high physical demand and effort, and this has led to more frustration when compared with the between standing position. There was no difference in operative time. There was no difference in complication. On the survey, most of the people said that the two-handed between standing position was voted as the best ergonomically. I have to acknowledge our study limitation. Some of them are the use of a simulator, the fixed ports on the machine that we are not able to move, and analysis of video recorded subjective tools. So in conclusion, as it's commonly performed in the US, laparoscopic cholecystectomy or simulated laparoscopic cholecystectomy performed with the side standing position poses a risk of physical injury to the surgeon. Until further investigations are made, adopting the between standing position deserves serious consideration, as it may be the best short-term ergonomic alternative. Thank you.
Very nice presentation.